So Ramsay Healthcare is a private hospital operator that's been around for more than 50 years. They've owned Victory Private Hospital for the last 14 years. Essentially, Wollongong Private Hospital is, we're transferring the service that we've provided at Victory to the brand new facility that is Wollongong Private Hospital. So 151 beds to start with. We can actually take over the rest of level 5 and 6 eventually, maybe 10 years down the track, and increase our capacity from 151 to 218. Benefits in terms of capacity, a lot of our patients still go to Sydney for their surgery and their healthcare, which is really disappointing. They don't need to go to Sydney, and this will hopefully attract more doctors to the region and therefore negate the need to go to Sydney for their healthcare services. We'll do obstetrics here, we'll do surgery here, we'll do medical in terms of looking after medical patients. But we'll also do new services including cardiothoracic surgery from mid-2016. We'll also start from day one interventional cardiology, which is a great thing for the Illawarra as well. They currently have to go to Sydney or have their procedures done in the public system. Day oncology as well is a new service for Wollongong Private. Currently, same deal, they either have to go to the Wollongong Public or another facility or further afield up to Sydney. So we'll be able to look after patients if they have cancer, if they have surgery for cancer, and have their chemotherapy here as well. Higher level intensive care unit. And we need that obviously to look after cardiothoracic patients, so that's a really important thing. The same doctors that look after intensive care at Wollongong Public Hospital will also look after our patients here at Wollongong Private on a separate roster, so that's really important to us as well. We've got great intensivists. 8 major operating theatres, 1 endoscopy theatre and 1 hybrid cath lab where we'll be doing the interventional cardiology and vascular angiography. So we've got 4 delivery suites, pretty much the same as what we have at Victory. We've done 1,000 deliveries or thereabouts at Victory for the last 15, 16, 17 years now, I think. And we don't expect that to go up enormously. We can cater for a few more, but in terms of a couple of hundred more if we needed to, but we don't anticipate the birth rate to go up too much in the Illawarra. We're going from 4 special care nursery cots at Victory to 6 special care nursery cots. So again, state-of-the-art special care nursery with all the bells and whistles. The vast majority of private rooms, that's something that Ramsay's been working collectively on as an organisation to try and remove shared wards as much as possible. Having said that, some patients actually like being in a room with another patient, so we've catered for both, but yeah, the vast majority of the rooms at Wollongong Private will be single rooms. It's co-located with the public hospital, which is great so that we can develop on those synergies being based closely to the public system, so good for the doctors in terms of access. So they can come and go and see patients at either facility. At the moment, if they're seeing patients at Wollongong, they have to jump in their car and drive to Victory. Depending on traffic, that can take a fair chunk of their time. There's an opportunity for them to lease space within the building as well, and that's a great opportunity for them, and a few of our doctors so far have taken up that opportunity, so I encourage more to do the same.